Hey there, I'm back, Charity Hukal from weidersehen 1-8. Today, I will be demonstrating how to administer parenteral medication. First things first, let's have the definition. Parenteral medication is the giving of medication through the parenteral route, or that which bypasses the gastrointestinal tract, and we make use of a syringe or what we call injection. There are different kinds of parenteral medication. We have the intravenous, which passes through the vein. We have the intramuscular, which is through the muscles. We have the subcutaneous, which is through the fats. We have the intradermal, which is beneath or below the skin. We also have the intraosseous, which is through the bone marrow. The parenteral medication actually has different purpose depending on the site of administration. What I will be focusing today are three parenteral medications, namely the intradermal, subcutaneous, and the intramuscular injection. Let's talk about the intradermal first. Intradermal are also called intracutaneous injection. This actually has a slow absorption rate, and the angle of injection is 10 to 15 degrees. Common sites of injection are the inner aspect of the forearm or the scapular back. Also, we have the lateral of the upper arm. Purposes of the intradermal are normally for antigen testing or for allergy testing. We also have for tuberculin test. We also do the intradermal injection in case of anti-rabies vaccination and also BCG immunization. So we do here circular colloid mark on this area or on the other side. That is actually your BCG vaccination when you are young, and that is done intradermally. Next, we have the subcutaneous injection. This route is actually for medications that are absorbed slowly and to promote a sustained release of the medication. Common routes are the abdomen. We also have our scapular area, also the upper arm here, and we can also do the subcutaneous and the lateral aspect of our thighs. A common example is, of course, the insulin injection. And of course, we have the intramuscular injection or the IM, which is among the three the fastest route of administration because of the vascularity of our muscles. The purpose of this medication is actually to promote rapid absorption of the medication, since this area has various blood vessels. And the most common sites are the upper arm, which is the deltoid. We also have the lateral aspect of our thigh, which is the vastus lateralis. On the buttocks, we have the ventrogluteal. Of course, before we give the medication, we have to do some assessment first to make sure that we will be administering the correct medication to the correct patient. And here are the assessments that you need to take note. Check that appropriate method for administration was ordered. Assess condition of administration site for presence of lesions, rash, inflammation, rigid dystrophy, and ecchymosis. Assess for tissue damage from previous injections. Assess patient's level of awareness. Check patient's written and verbal history for past allergic reactions. Review patient's chart noting previous injection sites. Don't forget the 10 rights of drug administration: medication, dose, time, route, patient, educate, document, refuse, reason, evaluation. Observe this before, during, and after your procedure. Of course, before checking everything and before facing the patient, you have to prepare the medication beforehand. So by preparing the medication, you have to prepare or gather the equipment at once so as to prevent legwork and thus saving your time, effort, and your energy. So here are the basic materials. You have your medicine tray where you put your medicines, and of course your other equipment. Okay. Also you have your syringes, appropriate syringes with appropriate needles. Of course your medications. So what I have here is a medication in a vial. So usually in a vial solution, you can use it several times. Okay, and also an ampule medication. So what I have here is an improvised ampule. Ampule usually is a single use only, and later on I will show how to open the vial and my improvised ampule. Also, we have here the wet and the dry cotton for our disinfection and to cover the site later on. Also, an alcohol swab, a micropore of course. I also have here a gloves. You can also use a clean gloves. And alcohol, of course, for hand hygiene, and a gauze pad in case the gauze pad is used to open the ampule if in case you do not have or your facility does not have an ampule breaker.